we knew about oxalates. The medical community knew about oxalates 100 years ago, or let's say 150 years ago. And then what happened? Because this is really interesting to me, having been trained as a physician, the Flexner report, and what, like, how did all of this knowledge get lost? I mean, like you said, in the late 1800s, doctors knew about oxalates, but doctors don't know about oxalates today.
Yeah, for nearly 100 years, we knew about oxalates since about 1842, when it was officially announced, we're going to call this the oxalic acid diatheses, and then later it became the oxalic acid syndrome in the early 1900s. And it wasn't until the late 30s, early 40s that we kind of dropped thinking about it. And that was in the wake of this transition from medicine just being another set of quacks who were bleeding everybody, along with everyone else, all the other quacks out there. They were going to be the top dogs by making it very exclusive. We were going to tighten up on our education and make it exclusive to get in school and very exclusive to get licensed to practice medicine. In order to make it an exclusive thing that worthy of paying high tuition and going through all these years of training, it was going to be very technical. So we were going to start using technology to define health and illness. So we started using blood tests as the only definition, only way to inquire into the well-being of a patient. And we've started to drop over time. Even now, the physical exam is gone. We don't bang your tendons and watch your tendons and evaluate your nervous system or feel your parts and pieces and see how your inflammation is going. We really have dropped that because we just order tests, and read tests. And blood tests don't catch a lot. And also what it does is we've now defined prevention with high-tech tests that is really just about early detection for problems that we can make a lot of money treating. Cancer and heart disease. We can drug you up and do all kinds of expensive procedures if we can show that you've got cancer and heart disease before you die of it. And that way we can patient you from a profit perspective. And so we transition into this profit orientation, this high-tech orientation and profit orientation, where we've really dropped health care. And now we have intense disease care. And it got worse when we changed the hospital system to a for-profit system. It used to be when the Shriners, my dad was a Shriner, and the Jews and the Catholics and everybody had their hospital. You went to the Jewish hospital or the Shriners hospital or the Presbyterian hospital because it was nuns and volunteers and community do-gooders who helped to make the hospital pay its bills. Like, they wouldn't always count on the patients being able to fork over $500,000 for their treatment. It was done as a charitable operation. But once we started having federal monies pay for patients, then it was a guaranteed income, and you no longer needed that nonprofit model. You actually had a model where you could start to profit from healthcare. And that has taken things off the deep end in terms of not being healthcare anymore.
It's definitely changed. And it's true that in the early 1900s, late 1800s, Western medicine was kind of a Wild West. We were doing crazy things. Some of those things we still do today. We still use leeches if people have a wound or a graft and they need to have it not coagulate. But a lot of the stuff we don't do anymore. We don't do bloodletting unless someone has iron overload and hemochromatosis. We don't do these things. So the intention may have been good, but it for some reason, it seems like with that Flexner report in the early 1900s, there was a loss of attention to diet. And perhaps that was the beginning. And there's all sorts of theories about the Rockefellers and their focus on pharmaceuticals. And who knows? I'm sure someone has written a definitive tome about what actually happened in medicine. But something happened. And perhaps those with naturopathic training will know more about the history and the transition. Something happened where we lost, as physicians, specifically as allopathic physicians, because I was trained as an MD, we lost much appreciation for the way that foods affect health and disease. And that's just not taught anymore. I mean, our education, you were traditionally trained in dietetics, right? Some sort of nutritional stuff as well?
Yeah, I got a human nutrition degree at Cornell University. And for several students in my group, and this is still common today, colleagues were there as a pre-med program because it's all biochem and nutritional biochem and lab and this and that, So you get all your heavy science out of the way and nutrition degree. And interestingly, my lab partner was a pre-med guy, and he had no patience for food class and any of the stuff that wasn't. He was not going to med school for nutrition. He could care less about nutrition. He wasn't there for that. And I think that's generally the case, that people who choose to go into medicine are not in there to hold your hand and ask you about your salads. That's not what they're doing it for.
It doesn't seem as prestigious when you're asking someone about diet, because there's dietitians or nutritionists that do that. I'm a doctor. My job is to do medicines. These are the magical shamanic shit that we get from the pharmaceutical companies. And this is what makes me a doctor. A nutritionist can't give you a medication, but I can. That is what
human beings are very prone to wanting layers in society. You see that in India where they have class system, and we supposedly flattened that, and now it's a meritocracy and we're all the same. But people choose fields like medicine because they want to be in the Brahmin class. They want to be in a special airified space and have those kinds of friends and drive that kind of car and have that kind of ability to like tell other people what to do. Like there's a certain, it's part of the interest in a field like medicine, is there's a sort of social chit you get with that.
Yeah. And I mean, that's true in medical school. I mean, people are interested in medications, and most of the research that we read, the vast majority of the research we read in medical school is funded by pharmaceutical companies. Our decision trees are based around pharmaceuticals. There's very few interventions in the medical system that have to do with food. Perhaps a gluten-free diet is the only one I can think of that off the top of my head. It's just, and yet we're leaving, in my opinion, and I suspect in your opinion, the most powerful interventions, the most profound interventions on the table in favor of synthetic medications, which are great in some cases, but often carry massive side effects and don't affect the root of the problem. So it's a real travesty what medicine has become.
Well, the public isn't always demanding a root cause answer. The public is willing to be bandaged together and say, just give me something so I can just keep doing what I do and don't have to change my lifestyle. And medicine has overemphasized that sort of non-compliance in their patients, as an excuse for not bothering.
Yeah.
So there's a lot of coercion going on with patients and doctors, but the diehards that follow this kind of discussion are really interested in root cause. They're much more interested in knowing how to stop the real problem and not just pretend things are okay with pain suppressants and other kind of crutches that we use to let us carry on and not have to change our lifestyle. So I'm really impressed with people who find the oxalate thing, and more impressed with how well they do on it. Like, it is a miracle cure for all kinds of untreatable, uncurable suffering. And the sooner you find it, the smarter you're going to feel. If you wait to pay attention to oxalates and then you have to later, you will kick yourself, because it's an easy way to feel better.